out of the way. Okay, thank you folks for joining us for our first place event of the spring 2022 semester. And thank you certainly to Dr. McKnight for volunteering. I won't take too much time. I'll just mention that our next event is going to be on February 8th. That's going to be one of our interfaith roundtable discussions, probably over Zoom at this point, maybe in 217 over in the University Center, but I think that's probably less likely. So probably going to be a Zoom discussion, and that link will be sent out in due time. But in any case, our first event kicks us off with the ANA code. Is that how? It's not Anna. Okay. The ANA Code of Ethics and Christianity, Biblical Foundations and Principles. This is a super lecture by Dr. Heather McKnight, who's Associate Director of Nursing and Associate Professor of Nursing and Director of Nursing here at A&M Texarkana. And this is part of Nursing 426, Issues in Professional Nursing. I think I got that right. So I will step out of the way. If you do have questions on Zoom, go ahead and put those in the chat, and hopefully we'll have some time at the end to address them. And I will mostly just spend my time admitting people as I can. All right.
We put you a chair over there too.
That's very generous. Thank you. All right, I'll be quiet.
You'll be quiet.
Yes.
All right, good morning. We're going to talk about the ANA, which is the American Nurses Association Code of Ethics, which is foundational to our profession. You guys should have the book. Okay, good. All right, we're going to start out first with a big.
I probably messed it up. I did. I'm the worst. There we go.
For the 20th year in a row, nursing has been named the most honest and trusted profession by the Gallup poll. The only year that we were not the most trusted profession was 2002. Who do you think got it in 2002? Firefighters. So for the past 20 years, actually, it's probably been close to 40 years at this point, nursing has been the most trusted profession, the most ethical profession. So the foundations of our code of ethics is what makes us that way. This information came out January 13th, so perfect timing for this talk. Should have got my clicker.
Yeah, sorry.
You're all right. This is basically just my references for you guys because we don't want to steal from people. So what is ethics? What do you guys think it is?
How you determine what is right to you in society and the world in general.
Yep, so there's a personal aspect to ethics. For nursing, we have the code of ethics to give us a little more foundational value to it. What else do you think ethics is? Ooh. What about doing what's right when no one is looking? Yeah. How many times as a nurse are you going to be taking care of someone completely by yourself? A lot. So is anyone ever going to know that you didn't swipe the hub appropriately? That you left feces on a patient? Is anybody going to know that when you walk out of that room? No, but are you going to take care of those things because it's the right thing to do? Right. So when you think about biblical principles, where does that fall in with do what's right when no one's looking?
It's a question of your morality and whether or not you can actively be a good person when you don't have to be.
Right. So your moral compass comes into play there. So most of us have some type of religious or spiritual foundations that we live by. Okay. Me personally, it's Christianity, specifically Baptist principles. Are those the only principles that can lead us in an ethical manner? No, but that's the focus that we're going to have today because that's my area of expertise. What I would love from you guys and from our group online is if you have different perspective, different religious principles or spiritual basis, please put them in the chat or y'all talk in or tag you into the conversation with how it fits with your religious or spiritual beliefs. Okay. Some of this conversation is going to be tough. That's okay. We've got to have the tough conversations to be able to care for one another and to stand and make the right decisions for our patients and family members, right? Okay. So when we're looking at nursing ethics specifically, we're going to look at the character of the nurse. Y'all kind of brought that up. Who you are, what you stand for, how you ought to be taking care of your patients. We're also going to look at your conduct. Okay. We've talked about it probably more than you care to remember over the past 2 years. You act one way in class, but then I see pictures of you half dressed with your liquor on the weekends. What does this do for your ethical value to me, to your patients? So again, looking at your conduct, make sure your conduct matches the ethics that you're trying to live with. Okay. Does that mean that no nurses have fun? Absolutely not. We have a lot of fun. But we also know what not to put out there and what good, clean fun looks like. Okay. No one should know if you like White Claws or Michelob Ultra or shots. My personal favorite, though, was the body shot pictures that I got sent. I don't want to know that you want people to take shots off your body either. Okay, so remember how you act is part of the code of ethics. They're all laughing underneath there.
Yeah, no.
So we also talk about the duties and obligations of a nurse. You have a duty to your patient. What is your duty to your patient?
To help them get better from whatever they're in the hospital for.
Right, we're there to help them go back to their baseline, to get back to where they were. Okay, we have a duty to other healthcare professionals because you work on a team, right? Our profession, nursing as a profession is still very young. In the United States, it's about the mid to late 19th century is when nursing really took off here. But we didn't become a real profession until the 20th century. That wasn't that long ago, guys. Okay. About 1950, we really took off. Okay. Talking about mid-19th century, most of your nurses were prostitutes and hookers. Okay. I don't see any of those people anymore, right? So we have evolved into, let's put the people who have nothing to do to work to a profession that is pushing us forward. Okay. The wider public, this has come into play pretty significantly over the past 2 years with the pandemic. Two sides of this, we're not going to get into the politics of it, but you do have a duty to the public as a nurse. So, who knows the stories of the Samaritans in the Bible? Okay. Where do you think the Good Samaritan Act came from? It's based on those principles of the Bible, right? So if Caitlin sees a wreck, nobody's there, does she drive by? No. Or yes, depending. Okay. Depends on her. I drive by when I had small children, when I didn't want them to see things. I don't have small children anymore, so I don't drive by, right? So that was my moral compass. Would it hurt my children more for them to see their mother covered in blood or try to fix something that I may not be able to fix? But with the Good Samaritan Act, we can't be punished for driving by, and we can't be punished if we can't save someone, right? Because we're doing an act of good faith. We're getting out, we're taking care of someone to the best of our ability without the resources that we have. Okay. Who else does that? Oh, that's right. How about the story of the lepers in the Bible? There's multiple stories y'all should have read before you came about Jesus cleansing the lepers. Could the lepers have given Jesus leprosy? Yes. Did he choose to help heal them anyway? Yeah. So what risk he took to help someone else. So how many risks do you take every day, even as a nursing student when you're in clinical? Let's go back to the blessed COVID. What are the odds of every one of you in this room having COVID by the end of 2022? I would say 99.99% if I had to guess. I made it 2 years. Calling that a win, right? Does every interaction with a patient expose you to things that could harm you? Yeah. So we take COVID out of the picture someday, right? There's still HIV. There's still Hep B, Hep C, Hep A. Ebola still exists. Did y'all know that? Yeah. So we're following Jesus's example by taking care of people, even though it puts us at harm's risk, right? Because it's the right thing to do. Okay. Global humanity, again, takes on a whole new meaning with the global pandemic. But think about this as well. Global nursing. Did any of you think it was your responsibility to think about how to help globally? Not convenient. No, it's not something we typically think about. I didn't think about global nursing and my impact until I went on a mission trip. We were in the mountains of Honduras, had somebody walk for 3 days. So I could clean the earwax out of their ear. To them, I was a godsend because they couldn't hear. They couldn't hear because they had earwax filled up, but literally walked 3 days to be seen. Can any of you clean out earwax today? So what is your global impact potentially as a nurse?
Relatively impactful.
Yeah. And it's pretty limitless. I went to Honduras with a Baptist dental mission. Sounds crazy to go with the dentist, right? But there's plenty of other options. I have a classmate from way back when. He goes to the Philippines, spends 2 weeks in the Philippines every 6 months doing care. I have another group that goes to Nicaragua. Spends 2 weeks every 6 months in Nicaragua. Dr. Moore and I have always said we're going to go do Nurses Without Borders when we retire. I don't know when we're going to retire, but Nurses Without Borders sounds really cool, right? Some of the things that you can learn with your global impact is not only do you take your skills, but you also take these ethics with you, your principles that you stand on, whether it is Christian-based principles or Buddhism or mysticism. Whichever option you take with you, you take that to those people and you touch their lives, right? But it all starts with your ethical obligation to help take care of people, okay? Isn't that sweet little baby? So thinking about why we look at ethics, are you taking care of vulnerable people?
Yep.
Every single day. I don't know a nurse who doesn't take care of a vulnerable person. Even when you go for your wellness checkup, whether it's your well woman checkup or your well man checkup, are you vulnerable at that moment? Yeah. At least from a woman's perspective, you're very vulnerable during your well woman checkup, right? People all up in your business. Depending on your age as a man, they may be all in your business too, right? So if we don't take ethics in with us, can you take advantage of those vulnerable people? So who's there to protect them? Ooh. Yeah, you are. You're there to protect them. So if you don't have an ethical foundation, are you really going to take care of them?
Probably not.
No. How many times have you heard of nurse-patient abuse or physician-patient abuse? Yeah, it happens more frequently than we want to admit. But again, we're not looking at our ethics. So when you think of Jesus working with his disciples, okay, remember Judas? What did Judas do?
He betrayed him.
He betrayed him. Did Jesus ever betray Judas? So think in that story, think through it and think through your patience. If we're going to live and treat people like Jesus, so everyone has a seat at the table, Jesus loves all. What about the patient who hits you? Yeah. Remember when you were kids and you would think, what would Jesus do if you were raised in the Christian faith? What's going to happen when your first patient hits you? You have to let it go. Yeah, let it go. Are you still going to walk back in and take care of that patient? Mhm. Because your principles and your foundations are to take care of everyone in their vulnerable state. Does it make it okay that your patient hit you? No, that's a whole nother conversation we're going to have this semester. But it is going to happen. I've been bit. I had a gun pulled on me. I've been hit. I watched a physician get his glasses shattered by a patient. Also had a few things thrown at me by physicians and patients. Okay. But I still took care of my patients. I still followed doctor's orders when it was appropriate for the patient. Eventually, that physician really liked me. Apparently, I knew what I was doing, right? But if I had walked away the first time he threw a chart at me and said, I'm done, I don't care what your patients need. Who hurt? Who got hurt in that process? The patient. I can go home and be angry all day long that I was mistreated at work. But I guarantee you my patients felt the love and care I provided for them. Okay? Even the ones who hit me. Had a nurse who got assaulted with deer antlers. Only in Texas, right? Do you bring deer antlers to the hospital with you? Much less assault a nurse with them. But that stuff is going to happen. But if you don't go back to why you're a nurse, my why, my foundation is because I want every day to live as Jesus would live. Take care of everyone, bring everyone to the table and let them know they're cared for and someone actually loves them. Are some of them easy to love? Like Judas? I still don't like Judas, by the way. I probably should, but I don't. Someday I'll get to that point. But you're going to run into a Judas every day in your career. So you're going to have to go back and say, what would Jesus do in that situation? So we talk about personal values. Again, this goes back to you. I can tell you my why. I can tell you my foundations. I can tell you what I prioritize. But does that mean it's going to work for you when you go to work? So part of your assignment after we leave here today is going to write out your why. What are you going to look at every day that's going to make you want to get up and go do this again? Because nursing is sheer hell right now. There's no way, no sugarcoating it. I think y'all probably figured that out about me by now, that I don't tell you it's all rainbows and unicorns, right? I don't know that there's a unicorn to find at the moment. And you're walking into one of the worst things I've ever experienced in my nursing career. So your why, your foundations, your compass is going to have to be pretty hefty. Kind of like if you say, what's your why for getting in shape? And it's like, oh, I want to lose weight and look great. How long is that going to last? Let's see, we're January 25th. Who lost their New Year's resolutions already? Yeah, okay. So it's going to have to be, you're going to have to dig deep. You're going to have to dig deep into what grounds you. What does your faith tell you to do? What does your compass tell you? What are your ethics? What are your values? Because trust me, some days you're gonna get up and say, thank you, Lord, I can go to work. And that's the best you're gonna get that day. It's not gonna be, I get to go take care of people and bring life into the world and I don't know. Hear a new baby cry. Yeah, some days you don't want to hear a new baby cry. You don't want to hear anything. So you're thankful I can get up and go to work. If you don't have your grounding, you're not going to get up and go to work. You're going to be that call in or that no call, no show. Who suffers if you're a no call, no show? Patients. Your coworkers. They suffer when you're not taking care of yourself. They suffer when you don't bother coming to work. Okay. So think about those when you're thinking about your personal values. Life experience. Before we do the ethics. Many of you are young in here. Some of you are late 20s. Some of you are not in your 20s anymore. Well, you know, I don't know what to call that group, right? The lost people. I'm somewhere in there with y'all, right? It's what?
Or it's a good year.
I'm thinking 40s are the best years. These will be the best years in a few years too, right? Every year is the best year. But some of you still don't have a lot of life experiences that you're going to walk into. Which group was it, Ms. Hedrick, that walked into Riverview to masturbation? Okay. Okay, so see, could anything in your life experience prepared you to walk into Riverview to all the patients masturbating? No, I mean, no. But at this point in life, you can laugh about it. I know you weren't laughing that day. Y'all were appalled. I know, because I got the phone call from Ms. Hedrick and she's like, oh my gosh, Dr. McKnight. First day of clinicals, they all had it whipped out. Unfortunately, that's still happening there. So Warren, level 2. Think about it though. Even our more seasoned, experienced students, were you prepared to walk in and see that? So nothing about your life experience is going to prepare you for every day in this career. Okay? Could you have been flabbergasted and embarrassed and not known what to do? Yeah. But how many of you took that as a learning opportunity and were professional about it? I'm pretty sure none of y'all laughed at the poor patients, right? Yeah. I bring that up because the teacher called me and said, hey, Heather, how do I deal with this? And I'm like, how do you deal with what? She's like, students masturbating. Like, you teach special ed. And she's like, yeah, he just told me to go on. I'm like, well, then you just go on. So it's not just you guys that walk into these situations that your life experiences haven't prepared you for, but do you have that foundational knowledge to deal with it? Yeah. So what do we do with those patients that are doing things that are inappropriate? Boundaries. Boundaries.
Remain professional.
Remain professional.
Don't reward like the behavior, like ignore it and it'll go away most of the time.
Yep, we're not rewarding the behaviors. What happens if you don't have that level of confidence in yourself? I think about, unfortunately, we've had a few 17, 18-year-old nursing students in the past. Okay, they're phenomenal nurses now, don't get me wrong. They weren't equipped to deal with that even after nursing school. Okay. What that particular student did, hers wasn't a masturbation issue. Hers was actually a patient requesting her to service him. Okay. We've had long talks about frequently with this student. She wasn't here, but she told me there was nothing that we could have done to make her prepared for that. She cried Patients saw her cry, everybody saw her cry. So she's made it her mission to help other people understand what they're gonna walk into. She bases it, every bit of it, on her faith. She believes, and I see it in her every day, that she was put in that position to teach others. It was rough, y'all. I mean, sexual harassment would be an understatement for what she endured on that clinical day. But because of that, she's been able to help others understand how to grow and benefit. She walked out of the patient's room to the break room and prayed. Lord, help me make it through this. How do I approach this? She got a different patient. Patient's wife also might have beat him a little bit when she got there. But overall, she said if she didn't have her principles, her ethics, her foundations and her faith, she would have walked out of nursing school that day. Okay. How many times have you wanted to walk out in the past year and a half? Okay. How many of you have not decided to walk out yet? Okay. Hey, we're doing good. We're here. I didn't say yet, right? Please walk out on May 14th. Is that a deal? Y'all can walk out on May 14th. But think about those things. Those are hard aspects of our career that deal with ethics that we can't prepare you for. You have to prepare yourself for what you're going to walk into. Expect the unexpected and live with uncertainty, right? These are our branches of ethics. Not sure that any of y'all care to that level, but we've got meta ethics because we got theoretical thinking. People get to sit around and think about it. I don't have time to think, right? Do y'all have time to think? Our normative ethics, right and wrong, good and evil. That's pretty much where most of us live, looking at the normative. What do we feel is right and wrong? What do we feel is good and evil? There is a group that feels there is no good or evil. It's just what we say it is. What do you guys think about that? No good or evil, no right or wrong. We define it. It's a unique perspective.
I guess it would depend on your perspective. What's
Yeah.
good for one person might be bad for someone else.
Yeah. So drug addicts, do you think they think drug abuse is good?
Depends.
Depends, yeah. On where they're at in the abuse cycle. So we can get into some really sketchy things, thinking about right and wrong and good and evil. As nurses, can we put our bias of right and wrong and good and evil on other people? Yeah. How do we combat that? Back to that assignment, writing out what your values, morals, ethics, what you're standing on as a nurse. I base all of my nursing care on my Christian faith. I'm very aware of my bias with my Christian faith. Okay? I'm very aware of what makes me uncomfortable. And I'm open with my patients and their families if I am uncomfortable. Your patients and families are going to respect you more when you're aware of where you have issues. Okay? My goal, again, treat everyone like Jesus would. Everybody has a seat at the table. I love everyone no matter who they are, what color they are, how they identify. Does that mean that is easy for me every day? No, it's not. There are still concepts and interactions that are evolving that I ask a lot of questions about. I have a safe group of people I can have conversations with. They don't judge me. I don't judge them. We have open conversations to help me learn more. Okay. My plan is we're going to have somebody come and talk with you about conversations with transgender patients. It's a tough conversation sometimes, right? Unfortunately, one of our faculty had things thrown at her because she called a patient she instead of he. But the faculty member didn't know how the patient identified because the hospital didn't have the recording mechanism. So there's a gap there that we have to work on. She worked with some, again, safe space to have some conversations about how do we deal with that? Because it's not about, do we think the patient is right or wrong, good or evil for their identification of their person. We take care of the patient however they identify, right? Again, can it be tough? Can it be difficult when we think in terms of normative ethics? Yeah. My personal choices are my personal choices for my life. They're not going to work for Kayla. Okay? They don't work for Robert. They don't work for Alex. But know yourself and know where you get uncomfortable. We'll pick on Miss Hedrick because Miss Hedrick gets very uncomfortable talking about STDs. Okay? If you want to see her turn red, go ask her about syphilis. Sorry, Miss Hedrick. But she knows that. So when it comes time for that in class and in conversations with patients, she knows how to approach the situation. She doesn't project to me that I should be embarrassed to say syphilis or penis or vagina, right? She says those words, but think about that. Know what makes you uncomfortable. Know how you define good and evil and right and wrong, but also know that I may not agree with you, right? So we go back to biblical principles. How do you think God sees sin? Is the murderer any more sinful than the prostitute?
He sees it the same. It's all equal. It's all sin.
It's all sin. It's all equal. Okay. So we don't need to put our thoughts that the guy who committed murder is worse than the prostitute. Or here you go. Or the person who had a lustful thought about the man or woman walking by them. Oh. Those looks, guys. No worse to have a sinful thought than to kill someone when you're looking at biblical principles. So can you look at your patient who has HIV because they were promiscuous and had unprotected sex any differently than you look at yourself when you have a sinus infection? Nope. Can you look at the person who has metastatic cancer because they couldn't afford treatment early on or preventative screening any differently than you look at me who has a mammogram every year for prevention? Nope, all the same. So when we get into normative ethics, it gets tough, right? So know yourself, because your bias is going to come through in your patient care, whether you want it to or not. Okay. Applied ethics, again, we're going to get into the actions of your discipline. Fits there with the normative ethics as well. We're going to skip to this. So that Dr. Nakashian can smile.
I'm always smiling on them. But I do like it.
Yeah. So told you we're a young profession, right? This is where the code started, the Nightingale Pledge. I know y'all know that, right? Yeah. What is the best thing Florence Nightingale did for our profession? Ooh. There's a lot. She did a lot. There's a lot. She was a wealthy woman who took on a profession that was for the underprivileged, right? Clean air, clean bodies, and the warmth of the sun. What is basic nursing care based on? Hygiene, vitamin D, and open air, right? She laid the foundation for us, for the things that you should do no matter what. Do you want a dirty patient? Nope. Do you want to deprive them of the sun? We know why. We know the scientific basis of that now. She didn't. She just found that it helped people in the Crimean War to be clean in open air, right? So she started the code with the pledge. We went through the 20s, the 40s, and the 50s. We finally got the code of ethics. Why did it take so long?
Simple task.
It's not.
Code of ethics.
From day one, nursing has been predominantly a female profession. How many of you have ever got more than one female in a room to agree with every other female in the room? Okay, so now let's think back to ethics. I've got my right and wrong. I've got my foundations. Caitlin has hers. Dante has his. Ms. Hedrick has hers. Now let's write down what is a foundational code of ethics. So I really think we did pretty good in getting it in what, 26 years, 24 years? We did good. Okay. We revised it in the 50s, 60s, 70s, 80s, and early 2000s. The point there was to get rid of outdated buzzwords. Do you know how hard that is, by the way? Did we teach y'all patient or client? Oh, wait, we taught y'all both. Which one is the preferred method or preferred term, patient or client? Ooh, depends. I'm going to tell you patient every day. Our mental health care providers are going to call them clients all day long. The buzzword there is the interaction. A client gives you a different relationship than a patient. I'm caring for a patient. A client and I are having a mutual relationship, right? So we had to get rid of buzzwords, and we did it again in 2015. But we also tried to depoliticize the code. Now think about that one. But we also tried not to cause division amongst the variety and diversity within nursing. Okay. So again, young profession. Think about women's suffrage. Okay. The end of slavery. When did all that happen? Did it happen during this code? How complex are those two pieces of history alone? Don't bring in healthcare into it. Standing alone, women's suffrage and the end of slavery.
Extremely complicated.
Yeah. We still can't process it today. What happened then, right? Saw a video this weekend, and now I got to figure out who said it again. But if we treat our own as if they're not equal, the ones who look, speak, and talk like us, how do we expect to treat those who don't look, speak, and talk like us? I can chew on that for a little while, right? So amongst all of our code, all of our revisions, all of our changes, there will be more. I anticipate a revision happening in the next few years. But we had those major events happening that were framing our society. They've also framed our profession. Look in this room and tell me if you think the room mimics the demographics of the nursing profession. What's the highest percentage race and gender in this room?
Yeah.
White female. Okay. Our women of color are growing in nursing, but still nowhere near the white woman. Who do you think is the most privileged member of the nursing profession?
White male.
The white male. Okay. Now, who wants to ask me why?
Why?
Thank you. Most white men want to do two things in nursing. Work critical care or become a CRNA. How many white males work the floor? White men get to pick their job in nursing. Okay. Is it right? One manager told me once she picked all the men for her new grad positions because they were strong and they could move patients by themselves. Really? I move them by myself all day long because I don't have help. So even within our profession, we have a microcosm of things that are going on around us. So you can't ignore that in our evolution. You can't ignore that in our ethics. And you can't ignore that in who you are as a person. Now, can I get angry all day long that the majority of nurses accepted CRNA school are white men? I can get mad about it. But me getting mad about it, what's it going to do? Not a thing. I don't get mad about it because I don't want to be a CRNA. If I wanted to be a CRNA, what do you think I would do?
Go get CRNA.
I would do it. Okay. So what I'm going to challenge you guys to think about, how do we continue to diversify and become more inclusive in our profession? Because we're not inclusive at all. How do we reach those who we aren't reaching? Because that's your job. All right. When we emphasize the code, do you think any lay person has any idea what we're talking about? No. If I went down and sat down with Dr. Nakashian and said, let's talk about the Code of Ethics Provision 3, he would be like, oh, okay.
Sure.
Yeah. What do you want to talk about?
Yeah, you go first.
Yeah. Nobody is going to be able to sit there and say that. This is something they feel when they're with a nurse. Okay. My baby had surgery in July. Had the rib removed. Y'all gonna be tired of hearing the rib removal surgery or story before long, right? Was I a nurse when my baby had surgery? I was. They didn't know that. Did I tell anybody, hey, I know exactly what you're doing and you need to do it right? No. Were there things that happened that I didn't agree with? Yeah. But I had to be a mama for a little bit. That sucks, by the way. You can't control pain for your patient because the patient's your baby. But what do you think I looked for in the nurses who took care of her? Compassion. I wanted someone that looked at her like they were hers. She was their baby. They were taking care of her as if she was going to go home with them. Fortunately, Baylor is phenomenal. And we had 7 nurses in the course of 3 days. Had some students. Those were really fun. Every one of them treated her like she was theirs. If she cried, some of them cried with her. Some of them were like, oh my gosh, what else can I do? And I was like, hey, how about some Zofran? And she might stop vomiting, right? So what does compassion have to do with Jesus? Are you supposed to work on the Sabbath? No. Jesus was ostracized for working on the Sabbath by the Pharisees. Why did he work on the Sabbath? Yeah. People are always going to need help. So again, following the biblical principle of compassion, does that mean that I can't help you because, hey, it's my day off? Does that mean that I couldn't help the student nurses who were taking care of my baby because they had questions when they came in the room by themselves? I could have ignored them. But was that the right thing to do? No. Did I teach about JP drains because the poor student nurse sprayed serosanguinous fluid all over herself? I assured her my child didn't have any bloodborne diseases. We cleaned the student up. We talked her through it. Hey, this is a better way to do that. Don't point it towards yourself, right? But again, compassion for the nurse. She was having compassion for my child. So that's what we do as nurses. Okay. Some days it's going to be your day off. Sometimes it's going to be when you set those boundaries like I talked about earlier today. And sometimes it's just going to be because that's the best thing to do, right? Who do you identify as right now? If I was to say, tell me about yourself. Who wants to tell me about themselves? Oh, nobody wants to make eye contact, all right? Come on, tell me about yourself.
I'm a mom. I have 4 kids, and I am in nursing school.
Now, was to tell you about myself? I'm a wife, a mom. I'm a nurse. Being a nurse becomes your identity, right? So absorb that and think about it. And then think about, what does the word nurse mean? Okay. Ms. Hedrick, what does nurse mean to you? Well, I've heard stories, by the way.
Well, I always think caring and compassion.
Where do we get caring and compassion from? Morals and ethics. Yes, y'all see a pattern here, right? Do your parents teach you caring and compassion? Maybe. Not everybody has caring and compassionate parents, do they? Depends on the day whether or not my children would tell you I'm compassionate or not, right? When they were little, I said if there was no blood or bone showing, I didn't care. I really did, but you know, had a lot of bumps and bruises. But some people aren't raised that way. So can we have caring and compassion foundation without family influence? I became a nurse because of the care and compassion by an L&D nurse when I had my first child. My first career was not nursing. She cared about me. She cared about my baby and all the complications that were ensuing while my husband was 9 hours away waiting for a flight home. You may be that to somebody someday. Nobody in my family does have, well, they do now. My brother's in healthcare, but before that, it was just me. Now, can we build fences and all that fun stuff. Oh, absolutely. My family's great at those manual labor type things, but not healthcare. Although my brother says it's great when you're sawing off bones to know how to use a saw. Well, Craig, you keep doing that. I'm not gonna do that, right? So caring and compassion is something you get to decide for yourself. Look for the role model that actually shows you that, because it may not be the people you're around every day. Okay. Back to vulnerable. Remember EBP and vulnerable populations? Yeah. What was considered vulnerable populations in research and EBP? Older adults, infants, adolescents, pregnant women. One more. Mental health and prisoners. Okay. Are those the only vulnerable people on this earth? No. Every person you take care of is vulnerable. So while they're suffering, and while I feel like my stint with COVID, I suffered exponentially, Dr. Moore assures me I did not. And I can't argue with her because I wasn't hospitalized, right? But do you think Dr. Moore has ever diminished the fact that I hurt when I was sick? Yeah, she checked on me every day. All the way down to what's your O2 set and what's your heart rate and what's your exertional level. And I'm like, shut up. I don't feel good and I can't talk. Leave me alone. But just because you have 8 patients, one of them's a walkie-talkie, one of them's bedridden. Does that mean the walkie-talkie is suffering less than your bedridden patient? No. They may have more things going on than the bedridden patient that you don't see. So they're still just as vulnerable. Is your patient being discharged as vulnerable as your patient being admitted? Yeah. How many of you have gone home from the hospital and thought you were good? They told you everything you needed to know and you got home and you're like, oh crap. I don't know what this medicine is. Does that happen? It does. So you're still vulnerable when you're going home. So we're going to bear witness to things as nurses that are going to make you question every bit of your foundational principles. Every day. Told you I had a gun pulled on me. How many questions do you think went through my mind that day? He wanted his OxyContin. I did not have his OxyContin, nor was I going to go get it. He was quite willing to kill me over OxyContin. I questioned a lot of things that day, right? All the way down to the fact when I filed the police report, they had to write down all of my information in case something happened to him, because I would be the first suspect if something happened to that man. Like, why would I hurt him? He threatened to hurt me. And they said, that's why you would hurt him. I'm like, oh, okay. While you're bearing witness to these things, it's cliche. People tell you that as nurses, we are there when life begins and we're there when life ends. We are. Sometimes you're the only one there when life ends. What does that make you question?
What you should do for them in their final moments.
Mm-hmm. How do you interact with someone when they're leaving this earth? How do you interact with someone who just brought someone to this world who took a breath and only one breath? Labor and delivery is the most joyous place to be, except for when it's not. Right? It will make you question your foundation. Do you think I've ever questioned my faith as a nurse? Y'all, I had a 7-year-old kid with a chronic disease that I watched waste away in front of me over the course of 12 months. Watched his family members steal his methadone, so he was in pain. There was nothing I could do about it. Anger will come in. You'll question your faith. You'll question your principles. What do you think helps me? I start my day with devotional and quiet time, and I end my day with devotional and quiet time. I stay grounded in my faith to deal with what I bear witness to. There are other things that I integrate into my regimen that aren't Christian-based, but they're still self-care driven and they're still spiritually driven. Okay. So I practice yoga. I practice yoga for health benefits, but I also practice it as a time to have conversation with God. And some of it's not very nice conversation, mind you. Okay. But like when I had 104 fever, I'm like, seriously, are you trying to punish me? What did I do wrong? Why can I not get over this fever? But those are the things that I do. Do you think I would have made it, holy cap, 20 years as a nurse without something grounding me? No. Find what grounds you. There's a myriad of things that can ground you spiritually and emotionally and mentally, and you've got to find it. Okay. First time you watch a patient die, what do you think you're going to question?
If this is what you want to do.
Do you want to be a nurse? Do you want to do this? What did I not do? How did I kill them? The first time you give a med that decreases respiratory rate and heart rate in a hospice patient and they die 10 minutes later, whose fault is it? It's not your fault. You helped them through their final stages. Last thing, why do you think being present with your patient is important?
Helps them understand that you are there for them, and you care for them.
Yes. Can you be present with your patient if you are connected to the computer and think the chart is the patient? If you can't tell me the temperature of your patient's skin 6 or 7 times a day, I'm going to ask you where you've been. Why would I ask you what the temperature of their skin is? You got to touch them to do that. Can you touch them from the nurse's station? Can you be present from the nurse's station? Can you be what your patient needs you to be if you're not in the room with them? Remember, you may be the only one that they see love and compassion in. You may be the only one who touches them. You may be the only one who has a conversation with them. So what kind of legacy and ethics do you want to put into your patient care to make sure your patient feels every bit of it? All right, questions from you guys, and then we'll see if there's any questions there. They're like, we want community health now. This is too much. Right, do you think that each one of you can come up with something to ground you morning and night? From your personal beliefs? Okay, we have questions in there.
Let's find out. Do you mind if I stop sharing?
You can stop sharing.
Okay. Okay, yeah, granted, I muted all of them, so, yeah, sorry, folks. If you do have any questions, feel free to put them into the chat. While we wait for you to formulate what you want to ask. I have a question.
What's your question?
It was something that I've sort of thought about, I guess, in other contexts. This idea of nursing as an identity, right? What differentiates a profession that's an identity to one that's not? You know, why do we care how folks conduct themselves, maybe after hours, as you mentioned, with the body shots, in some professions versus others?
I've thought about that quite frequently, actually. So my husband played professional baseball for 11 years. If you ask him to describe himself, he described himself as a professional athlete. He lost his identity. They had the same type principles. He had to watch what he put on social media. He had to watch how he was perceived. Same type thing. So I want to say, from my experience, it has to do with our interactions with the community. You expect a professional athlete to have poise, purpose, and be a role model. You expect a nurse to be caring, compassionate, and in control of their behaviors. So that's kind of where I feel it goes. Sometimes it would be great if nobody cared what we did. We can lose our license over unprofessional character.
Right.
So we'll talk about Texas legal code in a few weeks for you guys.
A more specific discussion, I suppose.
Yeah, it's about 12 pages.
Oh, fun.
Other questions?
I don't have any in the chat so far, so we might have more time for these folk or
Where were you working when you had the gun pulled on you?
Hospice.
Is hospice your main background or?
No, my main background is emergency.
A hospice patient?
Yeah, the hospice patient. Mhm. Yeah,
What's
Makes
it
sense,
before
right?
nursing?
psychology. Yeah. And followed my husband around. So with my psychology degree, I did early childhood, forgot what they actually called me, but it was basically behavior modifications and life skill teaching to elementary children. Did that in Round Rock for about 6 months before we moved to Pittsburgh. So.
Did you like want to leave the bedside or did you just want to get like a higher education level?
I chose to leave the bedside because of where I wanted to be. Program development is a passion of mine. So when I left the bedside, I developed the stroke program at the hospital and then the joint program. Obviously, I've done program development here, so it's just something that was always interesting to me. In undergraduate psychology, my research study was on a grief program. So from 18 on, I've always wanted to develop things that helped other people.
So something that stuck with me, back when we took concepts, at the very beginning of our program, our instructor said, she addressed all the ladies and she said, you will be sexually assaulted in this profession. And it goes back to the story that you were talking about today with your former student, asking to be serviced by a patient. How do you, kind of wrap your mind around the fact that that's an expected, while it's not acceptable, obviously, that's an expected aspect of our profession. And I don't think that, if you were going to school to be an accountant and your teacher said, you will be sexually assaulted.
Depends on what type of accountant you're going to.
But how would we as students go into the profession knowing, like I said, every day we're putting ourselves at risk to take care of our patients? That just seems like such an extreme. But it's the reality of it.
I don't know of any other profession that receives the abuse that nursing does. So when I was in school, we didn't question, we just did. You knew you were going to have things thrown at you. You knew you were going to be assaulted. You knew all of those things. We're finding our voice. A&A, I served on a committee with them for the nurse abuse a few years ago. The biggest thing that I want you guys to know is use your voice. We have walked away from advocacy and policy and politics as nurses for a very long time. We've walked away from the foundational aspect of we're not just a science, we're actually a humanity as well. We're an art. So bringing everything back. So what I want you guys to walk out of here knowing is that you have a voice. There are people who will listen to you. And to make a difference, it's going to take people having the confidence to say this isn't right. Employers ignore it. Leadership ignores it. It is an expected, it's gonna happen to you. So to change it, you have to have the voice to change it, which we're gonna work on. So the biggest pro that I've seen happen in the past few years, Lauren Underwood is a senator, House of Representative. Anyway, she's a nurse serving in Washington. She's speaking out against nurse abuse. The more we get nurses in places of that their voices are heard, the better off we're going to be. The other thing is not accepting. The only reason the physician that I ended up with a fairly good relationship with didn't throw anything at me again was because I told him I was the same nurse on the floor as I was in the ER, and I wasn't an idiot, and if he threw anything else at me, that he would have a lawsuit. I magically became wonderful. You just have to stand up and not take it, and just know that you may have to change places of employment. When I worked for the hospice I worked for, they were going to do nothing. I was scheduled to see the same patient who pulled a gun on me less than 24 hours later. I walked. Probably the only time I didn't give notice. My notice was hell no, and I walked out the door. So standing up for yourself. And it's going to take a long time because it is an expected reality, kind of like older nurses being mean to younger nurses. There's no reason anybody should be mean to you because you don't know, because I guarantee you, you know more than they do. So. Other questions? That's a soapbox conversation.
Well, I don't know if it's customary or not in class, but in place at the end of events, we normally applaud. So let's say thank you. Yeah, well done. I'll go ahead and get this posted up on our not Facebook, sorry, on our YouTube.
Our YouTube.
I will link it to our Facebook too, though. We're all on social medias. It's great. And thank you very much.
Thank you.
Appreciate it.